I've been working with you for quite a while. Why this surgery is relatively rare?
I couldn't believe it. I said, has anyone ever gone home without having surgery before? And they're like, yeah, no.
I've sent you some patients that needed both of the joints done, both knees. I'm not going to send you someone who I don't think will make it.
Maybe it's a sign. Maybe you shouldn't go to Lithuania.
They probably saved my life. My name is Arlene Roberts. I'm from Calgary, Alberta. I came over here to the clinic to have two partials, as they call it.
The case that it's bilateral, usually when the patients get something with their knees, like with the disease. Again, it's idiopathic, it means we don't know what it caused. It was not the trauma, it was not surgery that was performed before. So patients usually get their both joints involved in that situation. Well, there's a place where you can do partial replacement because the disease only damages the medial part, usually the medial part of the knee. We can see that the main changes are in the medial part of the joint, the narrowing of the joint space and some osteophytes. We don't have a lot of changes in the patellofemoral joint or in the lateral side. There can be some changes, but we can solve it during the surgery. And the point of this surgery is just to replace the medial part. So three parts, the femoral side, the tibial side, and then we have bearing that works as a meniscus, so we pop it in so it can move freely and don't cause any pain and restore function. The thing is, with this implant, you have to be eligible for the surgery. You have to have ACL, well, of course, PCL, the collateral ligaments that are not changed and would not compromise the outcome of the surgery.
My surgery was scheduled for 2024 May, and I came over here and it was all prepped, and the day of my surgery, they gave me an ECG and determined that I had atrial fibrillation. I had an irregular pulse, which I didn't detect, I didn't know about. So they said, we can't put you under anesthetic because there's a risk of you not breathing. So I'm like, oh my God, like, are you kidding me?
We had a consult with the cardiologist and anesthesia guys, and well, it was taken that it was too much of a risk to do surgery on her because she has both knees that should be operated on.
Okay, so they said, well, we're gonna put you on some medication, we're gonna wait a few days, we're gonna see how you do, we're gonna send you down the hall to the cardiologist. They have quite the team here. So I went to see the cardiologist 4 days later, got on the medication they suggested, and on day 5, I had another ECG and my fibrillation was still there. So I went home. Sent me packing. I couldn't believe it. I said, has anyone ever gone home without having surgery before? And they're like, yeah, no. And I go, okay, well, nice to be the first at something, I suppose. So went back to Canada and felt very sorry for myself.
I had a great deal of trust come to me when you stopped a patient from going forward to a planned surgery that had come all the way over because of a new arrhythmia that you discovered. That gave me great confidence that when I send patients, you're not just in a rubber stamp and take them to surgery no matter what. You're very concerned about them, and you sent her back. That's the kind of a partner I like. I don't want to just have you be, everybody comes in, we're going to do everybody no matter what. We're still using our judgment.
There's too much risk, so...
That's right, we're in a business of risk. So it's a great experience to be able to work in a team setting like that.
But determined that I would come back. So I spent the summer of 2024 back in Calgary, and Marius and I coordinated that I would come back at this time.
Somebody would say that maybe it's a sign. Maybe you shouldn't go to Lithuania.
Well, you could look at it that way. Yeah, maybe it's a sign I shouldn't get my knees done. But you could also look at it like, well, they probably saved my life. They found out that I had this problem, this issue, which I didn't know I had. And so they don't want to go ahead and take the chance of operating on me. And once I heard that, you know, I could potentially stop breathing during surgery and have a stroke, I was okay to come back to Canada. There was no doubt that I was going to come back, for sure. Yeah, yeah. I applaud the thoroughness of the clinic because I had an ECG 1 month before I came to the clinic in May. And so the day of my supposed surgery in May, they gave me another ECG that morning. They didn't have to give me another ECG. They could have gone with my normal ECG back in Calgary the month prior. But them having given me another ECG the morning of the surgery determined that I have this Afib, as they call it, and it's good that I found this out.
She, by the way, had been cleared now, and she's all ready to come back and have it.
Heard that.
But-
So she has no issues now?
No.
Arlene,
Hi!
how did I...
Oh my gosh, how are you?
Where were you?
So nice to see you again.
Nice to see you again, huh?
I wonder if I'll get my old room.
Which one was that? 240?
You're not looking forward to the ECG, right?
No. But